to this very special edition of the KAJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And today we have with us Dr. Monique Nugent, a practicing hospitalist and physician leader, also an author, and we'll learn from her practical advice about how patients and families can take charge of their care, improve communication with doctors, and make better decisions. So whether if you are a patient or a loved one, this conversation will empower you to educate to navigate hospital care with clarity and confidence. Welcome to the show, Dr. Monique.
Good morning. Welcome so much. Thank you for having me.
Thank you. Thank you. Well, welcome to the show. Welcome to India in this online form, Dr. Monique. And I'm sure not just in India, but a lot of people across the globe will benefit
Yeah.
from what we are going to talk right now. We'll talk about navigating hospital care, how one can make the best of, what is available to them
Yeah.
and get the best from their hospital stay. So we'll talk about, but before that, let's learn a bit about your background, your journey, your story so that people know who they are listening
Yeah.
to.
Yeah. I am a physician based out of the Boston area. I'm a practicing hospitalist. And for a lot of people, that's kind of a new term when they think about medicine. A hospitalist here in the United States is a physician who only practices in the hospital. So I am an internist. I'm a board certified internist, an adult physician, but I don't have an office. Can't make an appointment to see me. I only take care of patients when they are sick and in the hospital. And so what that means is if you come to the hospital, the emergency department, you're having chest pain, you're having fever, you're vomiting, you're dizzy, something like that. And it's decided, hey, this person's way too sick to go home. They need to be hospitalized. I would be the physician to take over your care from that point on, making a care plan to get you into the hospital. Once you're in the hospital, running tests, making diagnosis, speaking to specialists, speaking to you and your family, coming up with the plan, prescribing the medications. And the ultimate goal is to help you have a good and safe discharge plan. So that's something else I spend a lot of my time doing, is talking to families about, hey, what can you handle at home? What do you think they look like? Are they good enough to go home? And then making that plan for home, if home is the place you're going to be. And some people can't go home. Some people need to go someplace else to get stronger or get more nursing care or something after the hospital stay. And help them make that transition. So my whole career is really built around hospitals, the experience of hospitalization for both patients and their caretakers and loved ones. And then also safety, improving processes, and making sure that when you come into the hospital, it's a place where you feel safe and supported. You're getting the things you needed, and behind the scenes, everything is running to make sure that you are safe. Because safety is one of the biggest, if not to me, the biggest issue during a hospital stay. I built my career,
Absolutely.
yeah, I built my career
Carry
around
carry on.
hospitals, and I love it. No,
Carry
no,
on. Carry
I
on.
was saying, I built my career around hospitals. I find hospitals are not places that people love to be, but I think it's a place where a lot of people kind of end up at some point in their life, and so it's a place where we really need to be aware of how we're going to interact and prepare for the time that we're hospitalized or a loved one is hospitalized who we're supporting.
Absolutely, absolutely. So I want to understand from you, Dr. Monique, is that with so many experienced people like you,
Mhm.
good people like you, working, in hospital, either in emergency care or in planned hospitalization, why is it that there is so much of discord between the patient and the hospitals? Means,
Yeah.
where is this discord? Why is this discord? How does this happen? And why does this happen?
There isn't a place where I haven't heard about this Discord, right? So I practice in the United States. You're based out of India. I speak to people in the UK. I speak to people in Canada. There isn't a place where there isn't this experience of discord, like you said. Now, if we think about it, um, you're coming to the hospital when you are feeling sick or your loved one is sick, and the situation, whatever it is now past your comfort and your control, right? And what is the one thing that we want? We want to control. We want to be in control of things so that we feel like we're going to get what we want out of the situation. We're making the decisions. We know what's happening. By just kind of definition, when you're showing up in the hospital, you're a little bit out of control, right? And then you go into the hospital, and a hospital is a machine within a machine within a machine within a machine, right? You are going to meet 20 different nurses, 5 different respiratory therapists, 2 different phlebotomists, 8 different doctors. All of this is happening really quickly. And while all of this is happening really quickly, you're still feeling sick and out of control, or your loved one is still feeling sick and you're feeling a little bit out of control. And then people come to you and they say, like, this bad thing is happening. Okay, so now I'm out of control, feeling sick, and now I have bad, scary news. And now you have to make a decision. I'm out of control. I'm feeling sick. I have bad, scary news. I have to make a decision. Plus, there's a whole bunch of people talking to me, maybe saying things that I don't understand, medical jargon, or I'm too out of it and confused to fully understand what's happening. I don't feel supported. The experience of being sick enough to be hospitalized is one that lends itself to feeling out of control. And that feeling of being out of control can easily lead to discord. But healthcare itself, at least here in the United States, still has a lot of shroud of like secrecy. People may not really feel like they're being told the truth, or they feel as if things are moving too quickly. They don't have a chance to participate. They're not being listened to. And so they already come in with their guard up. And then the people who are working are also working under experiences that maybe they have a lot of patience, they have a lot of demands, things also are moving quickly for them, right? So as fast as things move for patients, they move just as quickly for me with multiple patients, right? And those can lead again to people feeling like, well, someone should just listen to me. I'm the doctor. I'm the nurse. You should just listen to what I'm saying, and this would be right. And then we kind of get our feelings hurt, our egos bruised, and things kind of start clashing. The experience of being hospitalized is unpleasant. It's often painful, often unexpected, and then will lead to further complications in life. So I jokingly say, even the people who want to be hospitalized, right? Even the people who show up to have a baby, they are looking forward to that hospital stay. They're leaving with an extra piece, right? They're now leaving with something else they have to take care of. Now imagine you show up after having chest pain and you leave now with the diagnosis of a heart attack and coronary artery disease, new medications, new specialists. Like nothing is easy about a hospital stay, and a hospital stay rarely makes things easier either. And so it's just to me, a really unfortunate setup for that discord. And that's why I want people to learn from me and get some skills that maybe they can cut down on some of that experience. I don't expect it's all going to go away, but at least maybe you can have a little bit more confidence and feel a little bit more in control.
Absolutely, absolutely. So to understand this better, Dr. Monique, is that, see, a patient is a patient, and it is obvious that the person is out of control. Even if you put the best doctors of the world as a patient, they will be also out of control at that point in time if you are fearing a heart attack or anything. So a
Right.
patient should not be expected to behave, not in a very oriented way, as they call it in medical line, that the patient is disoriented, almost in a disoriented state. How do you expect the patient to understand everything? So isn't the onus more on the hospital system? And the patient has to deal not just with the doctors, but also with the staff who is at the ground level, making sure of the administrative arrangements as well as the understanding about their own illness, which is certainly
Mhm.
out of control at that point in time. That is where why they have landed, especially if it's a emergency care. And the third point is to try and understand the doctors themselves. So whose onus is it? Is it that hospitals have deliberately moved out of keeping those
Mhm.
people, which could be the ones who will immediately try and understand the patient, and have the patience to explain the patient properly? That whole thing is
Mm,
missing out in this whole system. Why is it not done? Have they done it deliberately with horror stories about, patients
mm,
getting fleeced, patients getting almost robbed in several hospital cases which we hear about. How do you explain this to a common person? So obviously a patient will be skeptical and suspicious of
Mhm.
anything untoward that he sees around without understanding, even if they are very correct. But a patient is a patient, and he should be treated like a patient, not just like in another statistics or some big wallet that has walked into an emergency care.
So you bring up a lot of really good points. I will admit that I am unfamiliar with the you were saying the robbery or feeling like people are kind of getting fleeced in the hospital. In the U.S., hospital stays are paid for through insurance because they can be so pricey. Most people are not able to pay for them, and they have their insurance cover them, and that's a totally different topic. How we pay for healthcare in this country. But what you started off with was who has the onus, right? You started the question with who has the onus to make sure the patient is heard, listened to, and cared for. And I actually believe that it is on both. What I say is if you want to be dragged through a hospital stay, meaning if you want someone to tell you what to do and you don't want to participate, that will happen. You will be dragged through a hospital stay. And at the end of it, you will feel just out of control, may not have gotten the answers that you wanted. You may feel like things are worse off than when you started, but you didn't participate. It really is on both parties. We still have to focus on teaching healthcare providers how to listen, how to communicate, and how to be advocates for their patients. Conversely, patients and families have to take it on themselves to be the advocate, to be the driver, to be the decision maker. You're 100% correct. When somebody is sick, they may not be able to understand and make all these decisions. But this is where I teach that you should have had these conversations with your loved ones beforehand so somebody can step in and can be that voice and can make those decisions for you. Because when you are sick, if you can't make those decisions for yourself for whatever reason, it can be that you are very confused, that you are disoriented, or it can be that you just feel so ill you can't participate right now. If you have another voice who you've spoken to, who understands what's happening and says, you know what, my dad's values are X, Y, and Z. My dad is having pain and he feels like this is a thing that would be helpful. My dad would never consent to that procedure. Or opposite, my father would consent to that procedure. Let's talk about that procedure. That will help you to drive your own hospital stay. It really is on both parties. And when either party steps out of that responsibility of participating in the care, that's going to make the situation worse.
Absolutely. So let's look at two scenarios, Dr. Monique. One is the emergency care. You walk into a hospital, and the emergency team there says that you need to get into hospitalization. And
Hmm.
the second is the planned hospitalization. Your
Yeah.
doctor has advised you planned. What is the best way one can, deal in such situations, either as a patient, and an emergency care? Many of the people walk in alone. Most of the time, they may
Hmm.
not have anyone at that point in time. If you have had a chest pain walking on the street or anything or anywhere else. So how do you deal, or how do you make the best of those situations, get the best for you or for your loved one, especially during this, emergency care, as well as,
Hmm.
when it's a planned hospitalization?
Yeah. So let's start with maybe the easier one, the planned hospitalization. If you're going in for a procedure, right? You're going in for a knee replacement, you're going in for your chemo infusion, something like that. You have set up this appointment and this time to come to the hospital. What you also should take time to do is set up all of the things that are going to support you before you get there. So whatever legal paperwork you have that would designate someone as a decision maker and a support, getting people to come with you on the first day of your hospital stay so someone else can help you be an extra set of eyes and ears and an extra mouth to advocate for you. And making sure that your admitting physician has everything that they need on their end for you to have a smooth transition into the hospital, right? So those are things that you luckily may have had the chance to sit down, talk with your physician, even choose your physician. or choose the facility. That's a very different experience of what, you and I were speaking about emergency care. Someone's walking down the street, they get hit by a car, or not even that ominous. They fall down, twist their ankle, can't walk, things like that. Um, this is where being how to speak for yourself and also get extra information and extra support. So if you can call your loved one and say, "Hey, I was walking down the street, I fell, I'm being brought to the hospital because I can't walk. Is there someone who can come to the hospital to be with me? This is where I'm going to be." Or if you can't, and there are lots of times where people are so sick that they cannot speak for themselves, they can't call a loved one. Uh, I don't know how things work in India when it comes to support paperwork, but in the States, sometimes we have paperwork that can be put into the medical system that can speak for you and say, "Hey, this is the person who I designate as a caretaker. Please call them. This is the person who is going to be my decision maker. Please call them." If you have a lot of that paperwork set up beforehand, even if you don't think you need it, and that's my whole thing is even if you don't think you need it, I'm a young, robust guy. I run 2 miles a day and I lift 300 pounds at the gym and nothing's going to happen to me. Um, that's not particularly true. You have the luxury of time to have these conversations, to think about it, versus someone who may have a complicated or progressive illness who may have to think about those things right now. But you should always be thinking about how to support yourself through an unexpected hospital stay. And the biggest way to support yourself is through community. That community you've built through your loved ones, your friends, your physicians, your specialists who know what's happening, who can chime in and say, tap me on the shoulder, "Dr. Nugent, I'm his cardiologist. This is our plan. Hey, let's stay on the plan." If I'm out here making things up that are new to you because I know nothing about you and I have no one to communicate with, then that can lead to things being a little bit different than what you would hope for when you first came into the hospital.
Absolutely, absolutely. Now, people hear a lot of stories, and not only hear, they see a lot of cases happening and hospitals getting fined and all that stuff. So people have got that impression that, especially in modern times, sometimes some hospitals or some doctors can be a bit more aggressive in that care,
Mhm.
prescribe things or suggest things which you may perhaps not need. Any other doctor will perhaps, or as a second opinion, third opinion, will say this could have waited. And people, that is why a bit maybe suspicious,
Mhm.
or look at things whether it is actually needed or not needed. Amidst such a history of all those stories and all, even as a patient or somebody close to the patient, how do you look at things or understand things whether they are a red flag or genuine advice down there?
Yeah.
Because on one side, you also want to listen to a doctor. In India,
Mhm.
doctors are very respected. It is considered still, in spite of whatever stories, a very noble profession. But at the same time, we also have the chance or the freedom to say no to a particular type of treatment. How
Yeah.
do you calibrate both the things, which is good for you, not just good for the hospital in terms of monetary terms?
Yes. So if you have the ability to get a second and third opinion, I always tell people to lean into that, right? To feel as if you're getting as much information as possible, that will help you to make the right decision. There are a lot of things, you're right, that maybe can wait, and say, "Hey, can I get another doctor to take a look at this?" And there are things that maybe don't have that luxury, right? So we talked about someone who fell down and broke their leg. Like, if that has to be fixed now, you also are feeling in pain and you would like that thing addressed now, then go for it. But if you have the ability to get a second opinion, a third opinion from sources you respect, definitely lean into that. Oftentimes, I find that the thing that people are really looking for is another ear to listen to and someone to help them think through things. What I call that person during a hospital stay is your care partner, the person in your family or your friends who you feel comfortable with sharing this information, and having a frank conversation with, hey, this is the thing that's happening. Because you may not always need an expert to say there's a red flag here, right? You may need someone else in your life who understands your entire situation and what's going on to say, like, you know what, that doesn't sound like what was going on before, or that doesn't sound like something that we really should be doing now, or like, hey, do you think we should get a second opinion? So if you feel like questions need to be answered, go ahead and seek those answers, right? And you're right, people want to go to a physician and feel like I'm getting the care, right? And I know it's really scary when we hear in the news, like you said, hospitals being fined or being sued, physicians being sued. That brings me some comfort to know that there's some other people out there holding people responsible, right? It doesn't sound great, but nothing is perfect. If there's ever an industry that never falters, I get a little bit like, "Oh, what's happening here?" Right? The fact that people are holding healthcare providers responsible, holding their feet to the fire for whatever it is, and then another body looks and says, "Hey, this isn't right. This does need to be addressed," gives me some kind of confidence to know that, like, yes, we are still doing things that make us reflect and make us say, "Hey, we can continue to be better." Right? But get that care partner, get someone to bounce ideas off of. And if you can, and you feel like you have the ability to get it done safely, get that extra opinion from another physician to help you make that decision.
Absolutely. One more thing I wanted to understand about the elderly people.
Oh, yeah.
Several times, elderly patients have felt, spoken also, which is difficult to prove that are not getting treated well. Ill treated, but difficult to explain.
Hmm.
How do you, or what is your advice for such patients who do
Mm,
not have very close people who will be along with them, but still
hmm.
they can get the best treatment as an individual, as a patient? Also, in terms of patient care, also the best advice as elder care. Not considered that this person is not going to be on the earth for a long duration of time, so they can be, no, you deal with them with not as much seriousness as it should be. How do
Hmm.
you deal with that? How does a patient, elderly patient, ensure that he or she gets the best of treatment for themselves? Not treated like an elderly person, but someone who will perhaps live a 50 more years. That
Hmm.
is the
Yeah.
type of attitude they want for themselves.
Yeah, no, age discrimination is a real thing, not just in healthcare, but everywhere. And you often find our elders will say they feel as if they're being dismissed in lots of different realms of society. Uh, Solo aging, the term that we use, meaning someone who doesn't have a lot of friends or family, someone who may be aging by themselves, is also even more difficult because as we get older, a little bit more frail, we do need support. We do need people to help us make decisions and to help us be guided and supported through not just a hospital stay, kind of everything, right? We find that also like in finance, like older people may feel like they're taken advantage of in finance, right? Things like that. It's kind of in every realm. Um, and this is where building a robust support system of not just legal documents, but maybe even professionals. Here in the United States, we have something called a fiduciary, someone who can take over and help with some of your financial decisions and plannings, as well as help you make decisions and support you through healthcare, saying, okay, we filled out all of this. This is what I know that this person would want and doesn't want. Someone who you can call to say, hey, I'm being hospitalized, or not just you, the hospital can call. I My last time that I was working in the hospital a few days ago, I had a patient who had a very similar situation where they had a court appointed person who was making decisions for them. And so it was immediately flagged. Oh, this is someone who I need to call. Right. And so if you are a solo ager or think you are going to be a solo ager or know a solo ager, really building a robust legal framework to support that person and trustworthy professionals to help support that person in their decisions as they get older is really the thing that they're going to lean on. People should not feel as if they're being dismissed. Nobody is disposable. And I hope people who go in healthcare really feel that and understand that. And so helping support our elders is really, really important, because they do require, really kind of a community. Just like you say, it takes a village to raise a child. It takes a village to help support an older person too.
Absolutely. One more thing, Dr. Monique, is that about the role of artificial intelligence. If we call hospitals almost like an industry, almost every industry is getting impacted with artificial
Yeah.
intelligence. Do you think, with artificial intelligence embedding itself into the hospital care system, will it be a better ride for the patients, or will it be much more difficult? A
Mm.
patient dealing with bots at the time of emergency or wanting to. How do you see this happening
Yeah.
right now? How do you see the trend? How do you see it as a future? How do I, as a patient, become ready for such a situation, or
Yeah.
anyone else? Today's, well, best physical health person can be tomorrow's patient. How do they become ready for
Yeah.
such a world, reopening?
So artificial intelligence has been used in hospitals for a little bit now, and at least when I was interfacing with it when I was in a leadership position, it was more kind of on the back end, helping to go through and aggregate data, in like faster time and in mass than one person could do, to say, oh, we have all this information and data about things that are going on in the hospital, right? So can AI lean into safety issues and say, like, oh, we are noticing a whole bunch of infections around this type of infection in the hospital, or is this an outbreak, and alert people what's going on? Or like, oh, we are having issues with this type of safety event, right? So that's one way for AI to be in hospitals, is kind of in the background to help with safety issues by going through data on a real time or more rapid basis than any one person or one set of people can do. The other thing that I think people have this idea that, AI is gonna kind of take over diagnostics, that someone's gonna walk in and say, "Oh, I punch in my symptoms and, oh, AI says you are having a heart attack." Um, and I don't really know how far that will go for lots of reasons. One really big thing is that being cared for is a human to human experience. And there are a lot of things that I'm sure the computers could do, but in medical school in the States, we spend a lot of time teaching people how to speak to each other, teaching people how to make that connection, understanding how to, you know, help somebody feel as if, hey, you're being cared for and you're being safe right now. Um, and I don't know how much AI can take that over. If it can support in the background, making sure things are happening in a safe and timely manner, even with diagnostics, giving people a list of diagnoses that maybe are the most likely, and some things are in there that maybe people weren't thinking of. Those things are great. In pathology, going through lots of cells, and helping to, again, make a more timely and more accurate diagnosis. Those are wonderful. But I would really, really hope that we don't get to a place where someone comes to the emergency department and, like you said, they're dealing with bots. That imagine that for our elders, right? That would even be 10 times worse, because now interfacing with technology and you're feeling sick and you're feeling overwhelmed. Oh my goodness, that's just not the experience that people want in healthcare. People want to be nursed, back to health. People want to have a conversation with their doctor, to say this is the thing that's happening now, that's been happening, that maybe I didn't put into the bot immediately because I didn't think about it, but it happened also 2 weeks ago. You know, and healthcare is a journey. What is happening when you first come in, and what is going to be happening when you're leaving. Um, the the line between that can often be a very zigzag path. It's very rarely just straight. And then also when we talk about some of the harder things to talk about, end of life care, new difficult diagnoses, new changes in lifestyle, those are really things that we should be doing human to human, you know, reaching out to touch each other in a way that brings comfort. And so maybe I'm naive that I'm hoping AI doesn't attempt to take over too much of those things. What I would like to see AI do is ensure um, timely and safe care, because those are the things that are going to make the difference. If we can be more confident that people are safer in a hospital, that's going to be the driver of improvement for everybody.
Absolutely, absolutely. Apart from this, there is this whole new, discussion about patients' data safety and all, with
Mm.
bots coming in, note taking by. As a physician, I would be inclined to share as much information for you to help me, get better. But if I know that everything is being noted down by a bot, I might be, and tomorrow it can be, that those notes might get shared with the insurance company. I may not be as open as I would be with a with my physician, and bots may not be may not be, as responsible in terms of as a human doctor would be. They would only note down things that are necessary for that particular time. There is a lot of things to learn. I want to understand then, coming to your book itself here,
Mhm.
prescription for admission, a doctor's guide to navigating the hospital. How have you dealt this difficult topic in one book? Help us understand who is this book for, and how can people, is it also for hospitals? How can people make the best from this book?
Yeah. So, this book is really for people who are experiencing hospital stay as an adult, who can make their own decisions, or who are supporting an adult making their own decisions. And I'm making this distinction. I'm not a pediatrician. Caring for children is a very different experience in a hospital stay. And so this is an adult facing book. And this book really kind of starts at the beginning. What is a hospital? And I know that sounds kind of like simple, but here in the States, there are lots of different hospitals that you may find yourself needing for lots of different reasons, right? And so, for instance, a VA hospital, a Veterans Affairs hospital that supports our veterans here in the States, those tend not to have obstetrics units. So if you're a pregnant person, you're not going to show up to a VA hospital because those hospitals tend to be for older patients who are not pregnant, right? That sounds silly, but I do go into just kind of those specifics, like what is a trauma center? What is a stroke center? And this book is really about helping you get some background information so that you are more confident. So when your nurse says, "Oh, you can't eat tonight because you have surgery," you understand why, and you're not particularly like upset and questioning that. You're feeling confident. Okay, this is because this is a safety issue, not just people not wanting to feed me or being mean to me. And the other part of the book is really about what I spoke about earlier, preparing. I have sections of the book where I want people to write down their thoughts around CPR, intubation. Would these be things I wanted if my heart stopped, if I stopped breathing? What would I want done for me? What does that mean to me? Emotionally, religiously, socially. I've seen people really suffer, and that's not something I would want to do. Or I saw a loved one have a really great outcome, and I would want to be supported in that way. People make these decisions for lots of reasons. It's not just a yes or no because the doctor says so, right? You may have lots and lots of your own personal reasons as to why you're making these decisions. And then the book is really kind of made to go through the 5 days of a hospital stay. The average hospital stay in this country is 5 days. Some can be much longer, some can be much shorter. But, like, what can you expect if the doctor says you need a biopsy? What is a biopsy? Why are we doing that? And what are the questions that I should be asking? This is really about giving you more information that you can read at your pace so that you can be asking questions and be making a plan, and also getting the supports that you need. A lot of people may not realize that, like, oh, letting my primary care physician know that I'm hospitalized can make a difference, right? Or activating a healthcare decision maker earlier rather than later can also make me feel more confident and supported. And so, how you are getting through that hospital stay with as much information as you can. One of my aunts jokingly called it a manual. She's like, "That's it's not really like a page turner," but I find that people who need it do find it to be a page turner because it's chock full of really, really good information. And I tried to make it something that's easier to read so that you read it, digested it, and then you can go back with your questions and feel confident that you're participating in driving your care.
Absolutely, absolutely. There is so much to learn about all this from you,
Oh,
Dr.
there's a
Monique,
lot.
and I'm sure a lot of people a lot would want to connect with you, learn more from you, learn more from your book. What is the
Yeah.
best way for them to do so?
The best way to find me is on my website. It is drmoniquenugent.com, drmoniquenugent.com. And that's where not only you can find ways to purchase the book, you can find it on Amazon or barnesandnobles.com, kind of anywhere you buy books online. But you'll also find my podcasts, blog spots, guest featurings that I've done, articles that I've written. I'm really very dedicated to helping people understand how to get more out of the acute medicine space. And so if you go to the website, Dr. Monique Nugent, drmoniquenugent.com, you can find all of that there.
Wonderful, wonderful. With this, it's a wrap on this very special
Oh,
edition
thank
of the
you.
KAJ Masterclass Live. Thank you so much indeed for joining
Thank
us.
you. It was wonderful.